The coronavirus outbreak now has 12 confirmed cases in the U.S. The latest is a man in Wisconsin. The list of cases of...
This morning, hundreds of Americans are leaving the Diamond Princess after days of quarantine on board the cruise ship. Okay. Now a rush for Paul and Cheryl Molesky to get off, with a man who introduced himself as an American doctor at their door.
Understand you guys want to go back to the U.S., is that right?
All of the Americans on board anxious to get off the cruise ship, now considered high risk for exposure to the coronavirus. Today, going by bus to an airport hangar, then a chartered flight back to the U.S.
We begin with that breaking news. Those coronavirus evacuation flights landing at 2 Air Force bases here in the U.S. this morning, carrying hundreds of Americans who were quarantined on that Diamond Princess cruise ship in Japan. And we know at least 14 people who flew on those planes are battling coronavirus.
All those passengers face an additional 2-week quarantine amid growing fears about the virus.
Here talking to Chinese friends and contacts is that they really don't trust the numbers that are coming from the government in terms of the rate of infections. Look, the latest numbers for today, an additional 2,048 cases, as you say, globally then more than 70,000 cases. And as you rightly point out, then the death toll, according to these data points at least, 1,770. But there's a lack of trust, certainly here on the ground, amongst people when it comes to the infection rate and whether or not, frankly, they can believe the government on these numbers. In terms of the policies to further restrict the movement of people, we're seeing that on the ground here in the capital. We went outside of the city. There are roadblocks in place now preventing people who are not residents of villages or townships from entering those places, roads that are sealed off. So clearly, officials here in the capital and on the outskirts are concerned that this virus could spread here. And in Wuhan and Hubei specifically, of course, we've seen more draconian measures put in place by officials there who have told families that they are not allowed to leave their homes unless it's an emergency, and that private cars are banned from the entire province, a population of 60 million people.
Now reports.
These pictures released by Chinese state media show a sparkling clean hospital floor with neatly prepared beds lined with perfect precision for victims of the new coronavirus. But this unverified video shared on social media paints a very different picture. The person who posted it says this is the situation in the emergency department of Hubei Provincial People's Hospital on Sunday afternoon. The hospital is in Wuhan, the epicentre of the outbreak. It is cramped and overcrowded. The Chinese Communist Party has insisted it is managing to curb the outbreak. Strict travel bans are enforced, especially in the Hubei province. Citizens are ordered to stay at home unless there's an emergency. But some public health experts say quarantine isn't the only answer.
This is a respiratory virus that has efficient community spread. That's not something that you can actually expect to be contained. It spread for probably weeks in China before anybody knew about it, since at least November. So it had seeded the world, and it's likely mixed in with our cold and flu season in many different countries because most of the cases are mild and not recognized. So I don't think this is something that's containable, and we really need to move from containment mentalities to mitigation because we're really wasting time and resources on containment.
France was the first country in Europe to confirm cases of coronavirus. Now it's the first to record a fatality linked to the outbreak.
I have been informed yesterday evening of the death of the 80-year-old patient who was getting treatments for the new coronavirus at Bichat Hospital in Paris. This patient was a Chinese tourist from the Hubei province and arrived in France on January 16th.
Elsewhere, the World Health Organization has issued a warning about what it sees as a global lack of preparation to deal with a virus like this.
We're concerned by the lack of urgency in funding the response from the international community. The world spends billions of dollars preparing for a terrorist attack, but relatively little preparing for the attack of a virus, which could be far more deadly and far more damaging economically, politically, and socially.
China has a pork crisis. The nation is home to the world's largest pork market and largest hog population on Earth. But scenes like this have played out across China since August 2018, when African swine fever started wiping out pig herds. Though harmless to humans, the virus is deadly for pigs. An estimated 200 million pigs have died over a cold so far.
It's a national emergency across Eastern Africa, but it's not coronavirus. Countries like Somalia, Uganda, Ethiopia, and Tanzania are seeing one of the worst outbreaks of locusts in decades.
The staggering number of locusts are causing chaos in East Africa. Some experts are raising the possibility that the gigantic swarms could make their way to China if the region fails to get a handle on the outbreak.